You're
I
pretty
think
good.
a little far. And I want some, can that drop down more?
It cannot, but we can angle it.
Okay.
Can you scoot this guy back?
Here, get it closer to me and then angle down, I guess. Okay.
The light has no more.
Alright, well, this is a different angle, but it's kind of interesting.
It is.
What's
It's a
up,
chair.
you guys? We're going to talk about implants and finding the right size for you guys. I think our camera angle is off, so I think we got to match Thomas's camera angle a little bit higher up for me to at least do this intro portion.
Okay.
What's up, you guys? Check out the new office back here. We got Wilshire Boulevard. We got Saks Fifth Avenue. Thomas, what do you think about lining that up a little bit closer?
You want this closer?
Yeah,
to
because
that?
I'm gonna lose people.
Gotcha.
You want to go in front of
Can you sure this can't go down any further?
No,
No, it's
low
locked there.
goes.
If anything, if this wasn't on, it might be able to drop lower, but the wheels give it another few inches.
Okay. Yeah, this is just maybe I should just stand.
You want it?
Yeah. I think I'm just gonna stand. I'm gonna stand up. As much as I like to sit every now and then. Cool. And then I think this one's a little fuzzy.
This one right here?
Yeah, I don't know why the color's different. But anyway. And then Thomas, why don't you, can you get right through here? All right, guys. I'm gonna try and juggle 4 implants. Almost. All right, here we go. Let me try again.
Got some competition now.
Yeah.
Seriously.
All right.
Wasn't only juggle around here.
These are very big. Okay, so we're just juggling implants. I'm not good. We're gonna have Thomas try this after me.
Thomas is good at it. Oh, there you go.
Ah, damn.
Good hand coordination.
Very good. All right. So we're gonna talk about how to juggle implants now. I'm just kidding. All right, let me get you here. Hold these. Okay. And I'm gonna get these kind of set up perfect.
Go for it.
Is there any way we can like put them a little bit lower and then angle them up?
Do you want to get your camera above them?
Okay. Yeah, that'd be cool. Yeah.
And then we can always go back a bit. You don't need to be so close.
Trying to fix these. Just need help. What's up, guys? We're gonna talk about implants. All right, going live together. I'm gonna decline. All right, can't go live together with me. All right, got too many things to cover right now. All right. Dr. Barrett, we're at my new office, you guys. Hope you like it. We're gonna dive into some things about breast implants. We're gonna get the main camera ready to go. We're gonna do sound check. Can everybody hear me okay? Give me a thumbs up. Yeah, all right, this one is dropping down on me
Yeah,
here.
the Instagram one.
Sure. There you go.
Yeah. All right, now I'm just gonna turn it a little bit more. There we go.
What do you want the implant just ask?
Yeah, cool. All right, so I'm gonna answer a couple questions, you guys. Oh yeah, give me thumbs up. I like that. Things that just make sense, right? Yeah, Yeah, all right. So we're going live. Dr. Barrett here. We're gonna talk about implants. Talk about what implants right for you. If you're thinking about implants at all, MRI after implants, I think it's a waste of time, a waste of money. I think you should just get them swapped out at 10 years. The rupture rate's very low until about 10 years. So if you swap it out, it's just not a big deal. All right, so we're gonna get into the main intro of this stuff, you guys. Is this one ready to rock?
Yes.
All right.
Keep back just a little bit.
Yeah.
Perfect.
Good.
Good. Good.
So let me see a smooth implant. Okay, cool. All right. So my name is Dr. Barrett. I'm going to talk to you about my name is Dr. Barrett, and I'm going to talk to you how to select an implant that's right for you. Well, the most important thing to understand is you make sure you go to a board-certified plastic surgeon and have an in-depth consultation before you make any decisions. But a lot of times it's helpful to have some information ahead of time about implants and things you should think about before that consultation, okay? So one of the first things you want to consider is your lifestyle. Are you a very active person? Do you, what is it that you're kind of looking for? You're looking to feel better naked, feel better in clothes. What proportions are you looking for? Start looking at photos, do some soul searching of what you want for your body. You want to look at the proportions of your breast width versus your shoulder width, okay? Do you want a little bit of side boob, a lot of side boob? How big do you want them to be? A C cup, a D cup? Bra sizing is very subjective. Victoria's Secret's very different from Neiman Marcus, so on and so forth. So you want to kind of visualize that in your mind. I generally don't see problems with size being a problem with complications or stretching long term, as long as we stay under 400 cc's. So if we go above that 400 cc threshold, certain things start to happen in terms of weight. They get a little bit heavier. They're gonna make up more on your body. You're gonna be into the bigger breast club, right? So the grass is always greener. You want them smaller, you want them bigger, but once we get over 400 cc's, they're gonna start to get to the point where they're gonna be there and they're gonna have a significant amount of mass that they could impede with certain activities. So you wanna keep that in mind. Also keep in mind, if you plan on having kids or getting pregnant later on, you may wanna be on the more conservative side because as you can imagine, breasts get bigger when you're pregnant. So you wanna leave a little bit of flexibility there for the breasts to get bigger with time, okay? So let's dive in. Let's talk about the different types of implants, okay? First of all, I'm holding a silicone implant in my hand right here. There's also saline, but I don't like saline because it tends to feel more like a water balloon and it has a rippling on the side, okay? So that's why I typically like to use silicone implants because if you see right here, you can see that there's very little rippling there. Also, saline implants have more of a propensity to bottom out or to drop, okay? Because they don't have this flat surface on the one side, whereas silicone implants has a round surface, it has a flat surface, so it fits into a pocket and stays better longer term, okay? I like silicone implants, they're gummy bear, so if we were to cut this open, the gel doesn't pour out onto the floor, which is a huge plus. In my opinion, they're extremely safe. There's really no advantage to having saline versus silicone. Saline, when it ruptures, it's like a flat tire. Silicone, if it ruptures, it's like a run flat. The gel is cohesive. It doesn't really pour out throughout your body. It's not a big deal. It can be irritating if it does rupture, but most of the time people don't even know it, and then you swap them out at 10 years. It's no big deal. So now we've decided we want to do silicone implants. What kind of silicone implant would you like to use? Well, there's 3 different companies. There's Mentor, Allergan, and Sientra. I like Mentor. They're all good. Mentor tends to be just a little bit softer, a little bit more natural feeling, but they're all great implants right now. I want to show you the difference between the texture of the outside. Now this is a kind of a big deal. Smooth versus textured. It was a big deal recently because they found that textured implants can be associated with a rare form of lymphoma. I think with Mentor implants, texture was 1 in 52,000 could actually develop this rare lymphoma. I think with Allergan, which there was a recall, it was 1 in 3,000. Okay, so if you have an Allergan textured implant, make sure you talk to your doctor about possibly getting it removed if you want to. Again, those risks are pretty slim, but for some people that's big enough for them. And why we think that happened, we don't quite know. We thought it was a response to a certain bacteria that can cause chronic inflammation and so forth, which we're still investigating, okay? We don't see that same trend with smooth. So that's why I rarely ever use these textured implants. I use them in cases where we have recalcitrant capsule contracture or really bad pocket issues. But again, it's been pretty long since I've used one of these textured implants. We can pretty much do everything with a smooth implant. So there goes texture. Now, within smooth, there's actually 2 different things. There's shaped smooth, and then there's round smooth, okay? So you can see a shaped implant, okay? This is what people used to think were the only gummy bear implants, but gummy bear now comes in round as well, which I use, and that just basically means cohesive gel. Now this is a shaped implant, meaning that has more fullness on the bottom and more thinness on the top. And people thought, oh well, it kind of looks more like a breast, and yeah, that makes a lot of sense, but when you actually put it underneath an actual breast, it over projects the bottom part of the breast and it under projects the top part of the breast. So that's why I don't use shaped implants anymore. In addition, they can rotate, right? If a round implant rotates, not a big deal. But if a shaped implant rotates, it starts to look bizarre. So that's why a lot of people aren't using these shaped implants anymore, with exception with breast reconstruction, where there is actually no breast tissue, and then a shaped implant kind of makes sense. So that's the story on a teardrop shaped implant versus a round shaped implant. Now the next division and characterization is profile. Okay, so this is a high profile. Let's see, 350 cc's high profile implant, and this is a moderate profile implant, but this is actually a lot larger. This is 500 cc's. So one of the things you can see is even though this has less volume, it sticks up more and is more narrow. This is a moderate profile, which has less projection and more width. I typically recommend a moderate profile implant versus a high profile implant because it has a more gradual surface to support the weight of the implant, less likely to fall off to the side. Have you ever seen those people in yoga class that they look great standing up and then they lay back and then whoo, it goes right off to the side or goes into the armpit? Less likely to happen with a moderate profile implant, okay? High profile tends to do that more because it has kind of a water hammer effect over time. It kind of boom, boom, boom. It makes a lot of pressure and a small surface area on your chest. The other reason I like it, it looks more natural, okay? So we're going partially underneath the muscle here. So we go partially underneath the muscle with the implant, so you get more of a teardrop shape, and it also gives you more cleavage because it's more wide, okay? But sometimes I still do use high profile implants when I have dramatic asymmetry, so on and so forth. But these are all things that you will go over with your plastic surgeon during your consultation. All right, so I'm gonna open it up to questions, you guys. Also, for you, if you have any comments, questions, feedback, make sure to leave it right here on my YouTube page. Don't forget to give me a thumbs up, and feel free to subscribe if you want to see more videos just like this. All right, that was for the YouTube video, guys. Now we're back on live. So let's see, what's the starting cost? I think like 11,500 for a breast augmentation, okay? But we do have another doctor here who's a little less expensive that you guys can check out. Let's see, what's your opinion on Mentor Nitrel? I like Mentor implants because they're just a little bit softer, a little bit more natural feeling, but Allergan implants are certainly fine as well. Do you like round shape? Yes, I do like round shape. Let me grab a round one really quick.
Style 15.
Yeah, that's cool. So a round implant is really nice because if it rotates, it's not a big deal. And I put it on, this is your pectoralis muscle. I go underneath the pectoralis muscle so you get more of a teardrop shape versus, a shaped implant would just under project the top part of the breast and then over project the bottom part of the breast. Definitely want to go underneath the muscle. We don't want to go above the muscle. Well, yeah, let's talk about that. Let's talk about implant placement. So I like to go below the muscle because it gives you more of a natural look. Also prevents capsule contracture, and it looks way more natural. Okay, so you don't get that roundness on the top as you would if you were to get an implant above the muscle here. You would see this circular round appearance. I call it the $5,000 Vegas Billboard Special. It's a saline implant above the muscle, 15-minute operation, and you see it at all the pool parties in Vegas with people going around. It's just like, oh, it's just way out there. Looks good at first, but then over time it may not look as good. All right, so let's see, what are the questions we have? What happens if it ruptures? If a silicone implant ruptures, the gel is cohesive. It doesn't travel throughout your body. It can be irritating. It's not very dangerous, but we do recommend that you actually exchange it out. Do you do rhinoplasty as well? Yes, I do. I do rhinoplasty. Just got high profile. Moderate wasn't discussed, but she has a wider rib cage. Elizabeth, that's interesting. A wider rib cage, generally you want to use a moderate profile because it's a wider implant. But I'm sure your surgeon had a reason for using high profile, depending on goals. There's a sizing difference between saline and silicone. Slightly different. Saline tends to look bigger for a lower volume because it doesn't have a flat surface on the back, okay? It's more like a baseball, all right? So, but again, I don't really recommend saline in terms of the best look appearance. For someone who works out a lot, below or above the muscle. So working out and going above or below the muscle, there's a lot of things that you should know about. Let me see another implant here. Just hang on to this one. So if you go above the muscle, you don't get any animation deformity. But animation deformity is if you're here and you flex your pec muscle, it goes like that, okay? Most people that get underneath the muscle, they learn how to control that and they're not flexing their, how many women are out there flexing their chest on a regular basis with their boob job? They're not. It's just an incidental thing that happens sometimes when you're naked. So it can be controlled. Now the advantage of that is it looks natural all the time. If you go above the muscle, you don't get that muscle animation deformity, but you see a circular round implant. May not be a big deal if you have big breast tissue already, but if you're thin, you'll definitely have a more unnatural look, which is not something I recommend. But if you work out a lot, under or above the muscle, it doesn't really matter. Okay, you eventually get used to it, and it's fine. The only caveat to that is if you are an Olympic bench presser. If you're like competing, it will lower your bench press ability by about 15% according to the studies. Okay, but most people, you wouldn't even notice the difference. All right, so let's see, thoughts on lobbyist. I don't know what lobbyist we're talking about. Do I need a pocket revision if they fall to the side of Alexis? It just depends on how far. I mean, if it's falling into your armpit, you may want to try and get that. I had a gastric sleeve surgery and hiatal hernia 2 years ago, and I had 6 children, which I don't have anymore. My breasts are way lower now. I want to get back to double D. How much? I don't know. We got to see. Like, you're probably going to need a lift, and you're probably going to need an implant. And so, you guys, if you want specific pricing information, check out our website, drdanielbarrett.com. Click on virtual consultation. All right, and virtual consultation, you can send in your photos, and you can talk to a coordinator. Can get you some ballpark pricing. All right, because there's a lot of things that factor into that. It's not just set pricing for everybody or everything. Okay, can you get implants at 50? Absolutely. I have a patient who's 65, just recently came in, wanted implants. Life is short. Live your life however you want to live it. She looks great. I don't do lipedema reduction surgery. Do you do D flaps? Not anymore. I used to, but I know a good doctor at UCLA that does it, Dr. Jason Rusine. Yes, I have YouTube video coming out soon about preventative Botox. Awesome, yeah. How much is staffing cost? How much does staffing cost for Botox? All right, let's see. Is fat grafting safe, Sophia? Yes, fat grafting is safe. It's something I do a lot of times if someone doesn't want to get an implant. And I respect that. If people don't want to get an implant, we can take some fat from where you don't want it and transfer it to the breast. Now, one of the things to understand about fat transfer to the breast is that it can move a little bit. It's not really predictable, and we only get about a half cup size improvement, okay? So if you're looking to go up a cup size or more, implants are the way to go. Fat grafting is an alternative, but again, you got to do multiple rounds to get more than a half cup size. All right. What's the average cost of a tummy tuck? I don't know. I want to do my arms. Do you do that too, more or less? What is the price range? It depends on what you need to do with your arms. Okay, if you need to do liposuction Renuvion, or brachioplasty. Okay, let's see. Can a belly button be fixed without having to get a mommy makeover? Yes, it can be fixed. It can be very challenging. Send us some photos on the virtual consultation. We can take a look at it. Have you seen an increase in reductions in your time as a doctor? No, I think the same amount of reductions, the same amount of, these past 6 years here in private practice has been about the same in terms of reductions. And can you take someone else's fat if you're too skinny? No, unfortunately, you cannot take someone else's fat because each fat has its own little genetic makeup of identity that if you were to take that person's fat, you put it in your body, your immune system would attack it. So that's the only problem. My favorite procedure to do is breast augmentation, guys, because it puts an immediate result on the table. It's very satisfying to the patient and my ADD because I see that result right away. 6 weeks, they're back in the office. They're like, I love my new body. I love my new results. I fit better in clothes and so forth. And that's why I love to do this operation. A lot of people think it's superficial, that you should be happy with the way you look and whatnot. But, my thoughts are, go with what you need to do to make you feel good about your body. It's a safe, easy operation, straightforward operation. Do you want to take a couple photos of me behind the scenes? Yeah. Cool. Can plastic surgeon prescribe Upneek? Yes, I think we can. Yes, I actually have that. It's Larissa Montana. I have Upneek, so I have that if you want to come by the office. Can you get dental work 2 months before surgery? Yes, you can. And what else do we have? Would you recommend over or under the muscle to avoid capsular contracture for patients with multiple breast revisions? Absolutely, you want to go below the muscle, all right? I'm just going to tilt this up, guys. It's falling down on me here. Absolutely want to go below the muscle. It helps prevent capsular contracture. Going above the muscle puts you at a 20% risk of capsular contracture, which we definitely want to avoid. All right. I have sagging going on from losing weight. Do you recommend getting a lollipop lift? Yes, I do. Lollipop lift is great. It is a much better lift than the anchor scar. All right. So if you're going to get a breast lift and you need a breast lift, stay away from the anchor scar. All right, Betsy Hall Finley out of Canada came up with a vertical breast lift, incision around the areola, just a single line going down. No need to do that horizontal line on the bottom. Okay, so absolutely, scarring is way better. I close in 5 layers. It's definitely the way to go. Can I do a lift without an implant? Just depends. Just depends. Adriana, if you want to get some upper pole fullness, an implant looks really good. Or at the very least, you could do a little fat transfer in the upper pole portion of the breast. If you just do a lift without that, you'll get a little sagginess on the top portion. All right, we have another question. How do you know if they have fallen too far after augmentation? Alexis, it's hard to really say. If they've fallen too far or not. If they feel like they're out of place to you, then maybe they're out of place. Go see your doc, see what he says, or he or she says. How long is the surgery and how long do they last? Surgery is about 1.5 hours to 2 hours. And if you call and you say, how fast do you do breast augmentation? If they brag and they say they do it in 15 minutes, run out the door, okay? You don't want to be going to somebody that does 15 minutes. There's no way that you can do all the number of steps that you need to do for breast augmentation if your surgeon's only taking 15 minutes, all right? What do I do for my breast augmentations? Really quickly, this is what I tell my patients. I pre-inject the whole area with numbing medicine, so when you wake up, it's not painful. It doesn't upregulate your pain over the next 2 weeks. I also do 7 different steps to prevent capsular contracture, and that's really important to help lower your risk of complications. And then I also close in 5 layers. I spend a lot of time on the pocket dissection to make sure it looks natural and it's not over dissected. I also preserve the nerves over here. I go through the perirelar incision. I go down and around your glandular tissue so I don't reduce your risk of breastfeeding ability later on in life. And I close my incision in 5 layers and I do a ton of scar management afterwards. So those are all the components of a really good breast augmentation that you should look for in your plastic surgeon. And congrats, Reginaldo, you're getting your breast augmentation. Who's doing it? Let me know. Do we need to stop medication before surgery? Yes, there's certain medications you need to stop, but you need to follow up with your doctor about which ones those are. Generally, those are blood thinning medications. Do people get rejection from their breast implants? Yes, not so much the implants, but more so a bacterial contamination that can happen. So the same things that we do to prevent bacterial contamination for the implant, for both sterility and capsular contracture, because believe it or not, capsular contracture is caused by contamination of the implant majority of times, and it's your body fighting off that contamination of that bacterial biofilm that causes that capsular contraction and tightness. Here we go, guys. You're bumping all these. Yeah, I got it. Perfect. Sorry, having a little audio visual problems here. Okay, cool. That's perfect, right like that. Yeah.
I don't mind.
Okay, yeah, just let it go. Yeah, it's good. Yeah. All right. Now, that same contamination actually can cause breast implant illness later on. Okay, much more rare than that than capsular contracture. Capsular contracture nationwide is 1 in 20. My rate's about 1 in 100, and I'm starting to think it's getting a little bit less than that. Okay, so that's one thing you want to ask your plastic surgeon. What's your capsular contracture rate? Find out what that is. My rate's about 1 in 100. So 1% of my patients go on to get capsular contracture of the breast, and we have to fix that. And what you can do is you can take a medication called Singulair that reverses it 50% of the time, and the other 50% we need to do surgery or remove that scar tissue and start fresh, brand new implant, everything else. But the good news is that Mentor, which is the company I use, has a warranty for that. So you can get that warranty and it covers in case that happens. All right, we just have a time for a few more questions, you guys. Is recovery hard, and how long is recovery? That's a great question. Recovery for my patients, if it's a desk job, they're back to work in 4 days. All right, so we do a lot of rapid recovery techniques, which is really important. And I want you walking right away. There's a lot of movement that you want to do. There's medications that we prescribe, but the biggest thing that I recommend is magnesium that helps the tight muscle spasms, and CBD instead of taking narcotics. I do prescribe the narcotics, but I recommend my patients don't take them, and most of my patients don't even take them. So you do magnesium, your CBD, and you're feeling great right afterwards. That helps kind of that stretching sensation, and so that it's not as painful. And then we recommend a bunch of other supplements like Heal Fast and so forth to help you heal faster, and red light therapy as well. I do red light therapy all the time for my body, for muscle recovery and for collagen production, but you can also do it for surgical recovery as well. Sunshine also helps as well, but the UV light, we got to balance that out. We don't want to expose your incisions to the UV light. All right. Okay, let's see. You know, sizing for a natural look just totally depends on your body. You know, when you go and you get measured, there's a base width measurement. We want to stay within whatever your base width measurement is. So if your base width measurement is 12 centimeters, you want to go as big as 13 centimeters or as small as 11 centimeters. You want to stay within that. Otherwise, you start running into problems. The implant can fold, right? And when you have a folded implant, it creates a tension point that can cause it to rupture more likely. So you definitely want to stay within your base width measurements, kind of like your shoe size. Can you upsize over that? Yes, you can, but I don't recommend it. It tends to look not natural. So it all depends on your measurements and your desired goals. I always keep my patients within brackets of like natural looking, something that matches their body, but within that, you got small, medium, and large. All right, we're just gonna take one more questions, guys, and then we're gonna move on. What type of magnesium? Roxy Shell, I recommend a magnesium by Biooptimizers. It's got 6 different types of magnesium in it. It's super well absorbed. That's my favorite thing. Okay, guys, that's it. Thanks for watching. All right, make sure you follow me on Instagram, drdanielbarrett.com. We've got breast surgeries coming this week, so you can check out how I do all these different steps that I talked about. And then you guys can also check out my website, breastbybarrett.com, to learn more information about breast implants. Thank you for watching.